Welcome to Mahaska Health Medical Minute, where we will talk with your local trusted experts to bring important healthcare topics for you, your family, and our community. Welcome to Mahaska Health Medical Minute. Today we're going to speak with Patty Malloy, our public health coordinator here at Mahaska Health. Patty gratefully offers to take time out of her schedule every day to talk and communicate with our community and update us all about the vaccine rollout. And today it's a beautiful, sunny, we're anticipating warm weather the rest of the week. So it's kind of a nice anticipation and break from the cold weather we've been having. Patty is going to talk to us today about the tiers, the pharmacies, a max vaccination plan, some numbers, the call center update. So we'll get a good information today from her, and we'll go ahead and start with the tiers. Patty, tell us where we are at and who we are covering with the tiers.
So currently we are in phase 1B, and that includes persons 65 years of age and over, and then also the tier 1 workforce, which is your first responders, firefighters, school teachers, and child care workers. We're looking at this week and possibly next week moving to the tier 2, which is our food, agriculture, distribution workers, and the individuals with disabilities living in home settings. I just kind of want to be clear on this. We still are under a shortage order. So when we say these groups, they are limited in those groups, even with the businesses and individuals with disabilities who gets the vaccine. So if they are in one of those tiers or the tier 2, we just want to make sure that they realize that it's when people can't social distance in their workplace. So if they're in close quarters where it's difficult to maintain that 6 feet distance, those people would qualify. But if there's others that have their own workspace, like say their own office, or they can work remotely, those persons wouldn't be qualified in that area, just because we are, again, in the shortage order. And same with the individuals with the disabilities in this tier 2. If they have someone that has to do direct personal care to them, they would qualify. But if they're more independent and can do things on their own, then they would have to wait for another phase.
I know it's really unrealistic to name off those specific businesses, but can you give me an example of what one of those businesses are? If we're in a community and we're unaware of what type of businesses do fit in that tier 2, can you give us a couple names of local businesses that fit in that tier 2?
Yeah, so we've reached out, or we've had people reaching out to us, and they're not able to social distance. But there's other people in those same workplaces that can, depending on what their job is, they can social distance. So we've asked the businesses that we've spoke to, and we'll be having a meeting on Wednesday with a lot more businesses just to kind of go over that criteria. So your first criteria would be in that group, the ones that really can't social distance and have to be around in close quarters with others to do their job.
That's really encouraging information that you guys are now currently reaching out to businesses. You're communicating with them. They are able to reach out to you. It's pretty comforting to know that that is progressing to this level, and this is something we've worked for months. Pharmacies, let's talk about that. Hy-Vee will be getting the Pfizer.
Yeah, that's correct. We found out last week that Hy-Vee was going to get some of the allocation from the state of Pfizer. So that's what they're getting in this next week. So they will have a different brand than we do the Moderna.
They still will. Let's clarify, that is still the 2-dose vaccine.
Right. Both Moderna and Pfizer are 2 doses. Your prime dose, which is your first dose, and then that booster dose or second dose. With the Pfizer, it's 21 days apart, and with the Moderna, it's 28 days apart is what they want to space those out to the best that they can.
That's great clarification. Mahaska Drug and Walmart continue to partner with Mahaska Health, Public Health. Walmart is now scheduling with us. Tell us that process.
Yes, we've been working on this centralized scheduling with emergency management and their team answering the phone. So that is set up for Monday through Fridays, 9 to 5, and that number is 676-3599. That's the call center. So this is pre-registration. We just ask people in the community if they want an appointment, through public health or one of the pharmacies that Renee mentioned, that you just go that route, and then we will be working with those pharmacies on doing a centralized scheduling, because what's happening is we have people on multiple schedules. So it is nice. I talked with emergency management, Josh Stevens, today, and they said they have about 1,442 people signed up. Some of those people on the list have already received their vaccine, so those are marked, and they're just kind of going down the list as people registered and fit the criteria. So their criteria that they're looking at is the 65 and older age group. Once you are registered, the next call you'll get is a call for an appointment. So I think that's where the patients come in. They also have several call lines. They also asked if we could just remind people that if you don't get through to them, it's best just to wait and call back, because they could be on the phone with people, all 3 phone lines or 5 phone lines at once, and they just want leaving messages kind of delays the process on getting back to people. So just call back. Again, if you're calling just to see if you're on the list, they don't take people off the list unless they've called in to say they've gotten the vaccine someplace else.
That's great to talk about the call center and giving us those numbers. We will talk on that here in a second. But just to clarify, again, Walmart is scheduling with the call center, and you fully anticipate a continued collaboration with Mahaska Drug on that scheduling.
Yeah, we're working with that this week.
Great. On to Mac's vaccination plan. Exciting. Want to remind everyone of the larger number of vaccines that could potentially come in the future. Continues to mean no delay on you getting that vaccine. Tell us your thoughts on the vaccine plan.
Yeah, so our goal is as soon as the vaccine comes in, we get it out to people in the arms of those in Mahaska County. So that's our ultimate goal. So we've been looking at some venues and have a team here at Mahaska Health, Public Health, and EMA that are working together to get that planned. We don't have that scheduled yet. Once we see our vaccine allocation, and again, we're getting 400 doses every week for that first dose. That's not including the boost dose or the second dose. The 400 a week is to give to people in that first round. The boost doses come later. So once we see more allocation and we can have a bigger clinic and we can give it more to the general public and not have to go through the different phases, then we will have a large clinic once we have the vaccine available to us.
Great information. Numbers. We're still allocated the 400 a week. Do you anticipate, or when do you anticipate in these meetings you have with the state? You're smiling at me, so you know this is a potential question, and I'm sure you've gotten it before, but when do you anticipate that happening, those larger numbers?
Yeah, we keep hearing, there's more vaccine coming, so I wish I could answer that, and many times a day I get asked that question. That's why I was smiling.
I should tell everyone that Patty smiles a lot at me during these interviews because she knows, and that's such a relief to know that she does have a smile on her face every day regarding these topics. But it's always interesting to hear her responses to these frequently asked questions. Johnson & Johnson. Tell me what your thoughts are on that rollout.
Yeah, I think we're hearing that the emergency use authorization is going to be coming, hopefully shortly, and that's a 1-dose vaccine. So that would make things strategically easier to do. Yeah, again, we don't know much about when that will be coming out, other than what we hear on the news, but once that authorization use is granted by the CDC, then the Iowa Department of Public Health will look at that as well.
Great. Will be anticipated by, I know my patients bring that up frequently, or on a weekly basis at least. And they're watching the news, they're watching social media, they're hearing about that Johnson & Johnson, mostly because of the single dose. And that single dose will really change your world. I'm sure you brought this up earlier. Give me the exact number again on the number of vaccines total that have been given to Mahaska residents.
Yeah, so far in Mahaska County, 1,721 individuals have had that prime dose. And then for the second dose, we've had 566 people vaccinated. So, in combination, we're sitting at roughly, 2,200 people that have been vaccinated here in Mahaska County.
Great. Another number I wanted to reiterate is the numbers that have come into the call center and how many have signed up for Mahaska Alerts, which we are still encouraging, by the way, to that number that Patty brought up earlier, 676-35 is that number for Mahaska Alerts. What is that number again that patients have signed up for?
So that's the pre-registration number that you can sign up for here in Mahaska County. And then when vaccine is available, the call center will reach out to people on that list in the order that how they qualify and the order in which the information was received, and just kind of go through that list. And again, we're getting the 400 doses each week. It's going to take some time, as half of that goes to our age group 65 and older, and the other half is going to the different tiers in this phase 1B.
This partnership is an ongoing with the EMA. Who else is involved with this process, Patty, to continue our thanks to their time on this?
Yeah, I think there's a lot of people that have been able to assist with that. I think MCG for setting up the phone lines. We have Penn Central Mall, which is where the site is located, and just emergency management and their volunteers, their CERT team. Just a lot of people that have really made this work. And it's really been great for our staff here, because we can work on the things that we need to work on, and the call center can deal with those large volumes of calls that we had been receiving. So appreciate that a great deal. Also, one thing I want to just say is that the call center, they will take calls to pre-register. They can also, let you know, yes, you're on the list. They can't always tell you what order it's in, just because as the calls come through, it's a pretty big list right now. Like I said, there's 1,442 names on the list when I looked before we did this. So that's a good number. Again, some of those on the list have had their vaccines. And if somebody gets it someplace else, they do appreciate you calling if you've been on that list. If you've gone somewhere else outside the community to get that vaccine, letting them know so they're not making that extra call and having to, they'll just move on to the next person.
Patient comments that I've been hearing have been very encouraging on the process. They are not afraid to let us know how well that has been going. Of course, your health and safety are top priority for the Mahaska Health Public Health, and it's really good to hear those. Anything else you'd like to add, Patty, today?
The numbers that we're seeing in Mahaska County with positive COVID cases is decreasing, as it is across Iowa. The hospitals, are feeling, I think, a little bit of relief seeing those numbers go down as well. But just, we want people to continue to, mask, follow the precautions, vaccinated or not, until we really get a good control of this virus.
Thank you for your time today, Patty.
Thanks.
Mahaska Health is dedicated to caring for you. We have a team of experts putting everything they have into your health and getting you back to what matters most. Same-day appointments are available, and our walk-in is open 7 a.m. to 7 p.m. Monday through Friday, 8 a.m. to 4 p.m. Saturday and Sunday. Our telephone number is 672-3100, and feel free to visit our website, mahaskahealth.org, for up-to-date information.